Hello everyone, and welcome back to my channel. My name is Dr. Stephen Roth, and I'm a board-certified oral and maxillofacial pathologist. It is October once again, that spooky time of year where we cover Halloween-themed topics on the channel. Today, we will be doing a deep dive on vampires and their suspected origin based in reality and medical science as part of my Syndrome series. But first, we have to get into that disclaimer, which is that all opinions expressed in this video are mine and mine alone and do not represent any organization that may employ me or that I may belong to, and that this video is for educational purposes only and should not serve as medical advice. Should you have any questions or concerns about your oral or systemic health, please see your nearest oral or systemic healthcare provider. A special disclaimer for this video is that it is not meant to be discriminatory against people with genetic conditions. In fact, it is my hope that by raising awareness of these conditions, we can separate the ignorance and the mythos from the reality, allowing us to keep our fun, spooky, mythical creatures separate from the conditions from which they're likely inspired. This will allow us to offer empathy, compassion, and support to those with these genetic conditions. With all of that being said, let's get into the video. A lot of mythology is likely based in fantastical observation. Observations of people and conditions outside of quote-unquote normal likely led to attempts to explain these variations without the benefit of the science, technology, and epidemiologic data that we have today. For instance, the Wolfman may be a rudimentary way to explain hypertrichosis, a genetic condition, or really a group of genetic conditions, that can lead to excessive hair growth, especially in places where hair doesn't grow or grows in a more fine pattern. Because of the limitations of the understanding of genes and genetic conditions, one way to explain this condition was to create a myth or a story to make sense of this difference. Unfortunately, this of course can lead to isolation and discrimination of people with these conditions, which hopefully has improved with our understanding over time. In addition to the Wolfman, another popular Halloween character, the vampire, may also have roots with a genetic condition known as Congenital Erythropoetic Porphyria, which may also be known under its eponymous name, Gunther disease. Congenital Erythropoetic Porphyria, or CEP, is a rare autosomal recessive disorder of blood caused by a deficiency of the enzyme uroporphyrinogen 3 synthase. This enzymatic defect leads to the accumulation of a product called porphyrin that can build up in the skin, bones, teeth, and other tissues. Clinically, CEP is characterized by severe skin sensitivity to light, which can result in blistering, ulceration, and even destruction of tissues that can lead to disfigurement, often beginning in infancy. This disfigurement often includes destruction of the nose and the lips due to their susceptibility to sun damage, which may lead to facial features similar to those representations seen in the vampire myth. This sensitivity and aversion to sunlight is also a part of the vampire myth. Importantly for the dentist, CEP can present with erythrodontia, or red stained teeth, a finding that may be the first presentation of this rare disease and may actually help with establishing this important diagnosis. These red teeth may explain the idea of tooth abnormalities of vampires and the consumption of blood given the red appearance. Interestingly enough, patients' urine will also appear red, which may have also contributed to this blood consumption aspect of the myth. Management of CEP is primarily supportive, including staying out of the sun, using sunscreen, red blood cell transfusions, and a medication called hydroxyurea and/or even a splenectomy. Hematopoietic stem cell transplantation is currently the only cure for this condition. Now, obviously, the entirety of the vampire myth cannot be explained by CEP, such as aversion to garlic and localization to Transylvania, but it is quite possible that this myth is derived from a multitude of scientific and historic origins. While vampires are a fun and spooky part of Halloween, it is important that we separate these fun characters from the very real people with this condition, and treat those with CEP with compassion, understanding, and inclusion. Thanks for watching my video. I hope that you found this video fun and informative, and if you did, be sure to share it with someone else and check out my other syndrome series videos while you're at it. Be sure to like and subscribe if you haven't done so already. Thanks again for watching. Be well, and happy Halloween.